Hey everyone, we're back here at Resnick Focus Center. I'm Dr. Rez, Doctor of Physical Therapy, and we have our awesome resident experts with us today. And so we have Cindy here on our massage table set up with Emsculpt Neo, and then we have Cassie here also. And so really excited to share with you guys what our resident experts can educate us more on this very cool technology. And so please tell us about the Emsculpt Neo and kind of, Cassie, why these are gaining popularity, why these high-tech devices are gaining popularity.
Yeah, absolutely. So Emsculpt Neo, it is considered a body sculpting device, or that's where it started. We have radio frequency capabilities within this applicator, as well as something called HIFEM, so high intensity focused electromagnetic energy. That is stimulating the muscle. And it's stimulating the entirety of the muscle. So if we are working out on our own, our brain can ask our muscle to recruit about 60 to 70% of the fibers, and that would be a high-level athlete, right? So the average person, even less than that. Mm-hmm. This device is recruiting all of those fibers, so we're seeing a greater transformation, a more total muscle health improvement, because everything is working and recruiting. So really awesome technology.
Yeah, totally love it so much. And so why do you think that people are choosing Emsculpt Neo instead of, other options?
Yeah, that's a great question. So this is patented. This is premier technology. We kind of pave the way. Part of the application too would be radio frequency, which is causing apoptosis, and that is programmed fat loss. Mm-hmm. So we're not only stimulating the muscle, but it's synchronized to also cause fat loss within that area. And beyond just fat loss, there's something called visceral fat, and that's fat around our organs. It's not healthy. We don't want that. So, right. Of course, aesthetically, the inch you can pinch, nobody likes that. But beyond that, for your health, it's really important to address that visceral fat. Emsculpt Neo does.
Mm-hmm. Absolutely. And so what are some of the benefits of Emsculpt Neo over something like a mommy makeover surgery?
So surgery is, it's an invasive process, obviously. It's not everyone's ready for that. Whether or not you're ready, you can use Neo post-surgery too, so I'd want to definitely make light of that. But this is something that will address the muscle. Whereas surgery, it doesn't necessarily address the muscle. So, yeah.
Mm-hmm. Yeah, surgery does not strengthen. And so even going through a invasive surgical procedure might give us aesthetically what we're wanting kind of sooner or early on. It definitely does not strengthen.
Right.
So, yeah, that's a good point that sometimes the surgeon is not going to mention how weak the muscles are going to be after being cut on to get the aesthetic piece to that. Mm-hmm. So what would we want to do for the Neo? How would we get started, would you say?
Well, definitely, I feel like core is the most important function. This device can actually treat glutes, arms, legs, calves, anywhere where you want to strengthen. But our initial thought with our devices is to strengthen your core. So we have me set up here on the abdomen. Radio frequency will also help tighten skin. So if you are larger, have more subcutaneous fat, anytime we lose fat, what happens to the skin? Laxity and sagging. So radio frequency will actually also help tighten the skin while we are burning that fat.
That is awesome. So you could almost say that Neo is giving us three things since we add the skin tightening piece on there. The fat or squish is being melted away, and then we're getting the strengthening piece. So that's pretty amazing all at one time. And so how many contractions can one expect in a Neo session?
So we say it's the equivalent of 20,000 crunches. And there is a cadence to the process. So about 30 minutes for your treatment. The radio frequency and HIFEM technology are synchronized. So they're working in a specific, I guess that speaks to your question of what makes it different too, right?
And so the technology is almost like helping us not be so sore after our 20,000 muscle contractions, and that's just phenomenal. So my clients usually give me the feedback that they can tell something's different, but it's not like they are sore, can't move, can't stand up, can't reach, rotate, do the things that they need to do, bathe, dress, reach, and get back into their exercise. And so they definitely feel stronger sooner.
Yeah.
And so that's awesome.
Yeah.
Great. So what else about the Neo is going to be just even different than maybe other products on the market?
So definitely what differentiates Neo, the same great technology we've discovered along the way. Of course, if you're strengthening your core, you are improving your posture, your center of gravity, your balance, and all of those things are so important. People experience improvement in lower back pain because when we're sitting our day-to-day lives, we're not recruiting the muscles like we should in our core. So there is an imbalance, and that's why people experience lower back pain in large part. But we've discovered that we can use this applicator on other parts of the body where people experience joint pain. The settings are slightly different. They're tailored to that need, but we're seeing improvements then with functional wellness as well in chronic injury. So
yes,
yeah.
I love that.
Yeah.
I love that. You know, and we don't know how weak we are until we're no longer weak. And so, because we've lived in this chronic state of our bodies have been weak, you know, and in physical therapy, we always love to see our clients before surgery and get those muscles strong before there's any invasive thing. And then so many times if we get the muscles strong and those muscle fibers better recruited, surgery may be not the option that the client chooses to go to because they're
That's
feeling great. You know, and so what about some downtime? Like if we are choosing strengthening, pure strengthening over surgery, what are some downtime differences that might be noticed?
As far as, so if you're choosing Neo versus surgery, it's certainly an awesome place to start, right? If your doctor approves, you know, it's non-invasive. You're not preparing for surgery and all that entails, and then the healing process thereafter. Often patients are seeing improvement immediately post their first session, but sometimes we're following that treatment series, and the practicing provider, of course, is going to follow you closely and tailor it to your needs because everyone is unique. But there's really not any downtime with it. So that's also the advantage. Yeah.
Totally. Yeah, because whenever we choose surgery, we now cannot care for ourselves. So we need somebody to care for us. And then also all of those strings attaching us to other family members, you know, a spouse, children, taking care of older adults, you know, in the family. Somebody else now has to step in and do all of those things instead of us because we're down. And so, and all of that additional burden that needs to be addressed, you know, and there's a cost to that. And so, but whenever we're looking at, hey, there is no downtime, that's a huge benefit. And plus, there's no risk of infection here because we're not doing something invasive.
We're not cutting into anything. Yeah.
Yes,
Yeah, there's a lot of benefits.
Definitely.
Always have to caution too, of course, if your provider approves, there's a right way for everybody, but it's certainly a great place to start.
Absolutely. I love that so much. I love options, you know, giving our clients our options and so that they can choose what fits into their life best. So should we start the machine next?
Sure.
Okay.
So Cindy is our model here. She is strapped up with the large applicator on her stomach. So we're going to be treating her abdomen today. How is it sitting with it strapped on you? Pretty comfortable, right?
Pretty comfortable.
Yeah. Okay.
I could almost fall asleep.
There you go.
Okay, so we're ready. We're going to start with your HIFEM, which is the strengthening component first. Okay, so here we go. And so, is that feeling okay?
Yes, that's great.
Okay, awesome. We're already seeing muscle contraction going on, and that was just at 30%. And so,
I think she's usually good right about there. Yeah.
Okay.
Yeah.
And so, and then I'll bring up your heat. And so we have the two components, and I love how Emsculpt Neo lets us change the HIFEM, the strengthening piece, separately from the RF piece for the heat.
Yes. Yeah, so it's tailored to the person, right? You might not need quite as intense of a treatment. It's still an incredibly great treatment. They're getting, you know, all the benefits, but each person might need different levels of each. So
yes,
based on your current level of fitness, pretty much. So, yeah. Yeah.
Awesome. So talk to us about what's happening right now.
Yeah, so you can visualize here when you see the muscles contracting. So it's going through that cycle of contraction. And then we did work up the radio frequency, which is the heat component, and that's going to help with, on this setting, we do want fat loss. If we're treating other parts of the body, specifically the glutes, we don't necessarily want fat loss there, so we will tailor the settings to make sure that that's not being heated to the level that would happen. Yeah.
Yes, I love how these taps are warming up the tissue. Is that right?
Yes.
And so getting that ready for this HIFEM exercise, this full 100% muscle fiber contraction, which is phenomenal.
Yeah.
This is something we can't do on our own. And so, like was mentioned, when Cassie said even high-level athletes are only recruiting 60 to 70% of their muscle fibers, but Emsculpt Neo is recruiting
100%.
Yeah, I get so excited about that. I know what that means, on the anatomical level, and then how that translates to improved function for our clients. And so it cannot be reproduced on our own in the gym.
Yeah, that's the good word for it. You really can't reproduce it. These treatments are what are going to give you that. So.
Well, good. Well, thank y'all so much for sharing your expertise with everybody. And I love the Emsculpt Neo machine. I love what it does for our clients. I loved what it's done for me, and just really that functional piece, And if we're better with our function, our balance, posture, and everything, then, a lot of times we look better also.
Yeah.
So, hey, we'll take it, It's all non-invasive, this walk in, walk out procedure. And so,
Lots of benefits, yes.